Hi, Ashley.
Hey, Dr. Pejic, how are you
I'm doing pretty
today?
well. What you got for me this week?
Well, I would like to ask you, because I've been feeling all over the place. When people think they have ADHD, but it's really something else, tell me about what it could possibly be.
Yes, there are several diagnoses that people come in with that are not ADHD but look like ADHD. The first one is anxiety. Why anxiety? Is because one of the core features of anxiety is poor concentration, namely generalized anxiety disorder. That's when you have muscle tension, trouble getting to sleep, worrying excessively, trouble controlling worrying, irritability and fatigue, and concentration problems. So folks who have that, they worry a lot about tests, about finances, about all things, and they may anxiously procrastinate, and that comes off as having ADHD. When in actuality, if they treated their anxiety, they would probably focus a lot better. So think about a guitar string that's taut, it's too tight, doesn't play well. People with ADHD have like a loose guitar string and they need to tune it up with a stimulant, so to speak. Tight guitar string is like somebody with anxiety and it doesn't play well. It needs to be loosened, relaxed with the medication. So that's kind of the part of the art of what we do. The second thing is marijuana use is another reason people think they have ADHD, but it's really just that they're stoned all the time for the parlance of our times. Um, and that's just somebody waking up in the morning using marijuana and they're foggy. And I'll have folks come in and see me and say, well, I have ADHD, and we go through the workup, and then they tell me they're smoking 2 grams of marijuana starting in the morning every day. And I have to say, hey, have you ever considered that this may be a problem? And it's always kind of a difficult conversation because people who are using at that level don't want to stop using it, or it's kind of difficult to stop using it, but can be done. The third thing that gets confused with ADHD is if somebody is using a substance in the evening, like at nighttime, and they're hungover the next day, and they're foggy minded and they can't get their work done. Think of like a college student who's going to the bar, a few nights a week and the next morning. Not, most people don't have that phenomena, but that's something that crosses my radar from now and again, since we're here in New Orleans and there's lots of colleges. In line with that too, another reason people come in thinking they have ADHD, just poor sleep, or they're tired. Say if somebody has kids, and they're not sleeping well, or they have a job where they're doing like lots of shift work or something and they feel foggy. It's just that they need like sleep and they need to catch up with sleep and have it be restorative. The fifth thing is if people have children, my 2 kids, when they're talking at me and my wife, and we're conversing, you just can't hear yourself think. It's very distractible. So if you're in an environment that's distractible, that doesn't mean you have ADHD necessarily. So if you're at home and there's TV on and there's kids screaming this, that, and the other, that can be a thing. And then the answer is like coaching patients on carving out time for themselves to do some deeper work, and so on and so forth. A sixth reason that people think they have ADD is that they actually have bipolar disorder, which also has that part of its criteria is trouble focusing. And for those people that don't know what bipolar disorder is, that's when their mood is extremely elevated, that they may feel wired, they may have way more energy than not, they don't require as much sleep, they're distractible, they're impulsive, they want to have more sex, they want to spend more money. Sometimes people want to do drugs when they're elevated to that degree. And I'll have patients come here who were talking a mile a minute, which we call pressured speech, and they look like they have ADHD, but they're manic, which is one of the phases of bipolar. The other phase being depressed. So it can sometimes be bipolar disorder. And the last thing I see a lot is people are simply just not prepared. So think about somebody taking their midterms or final exams. They come in and they want Adderall or they want Ritalin. They want to get it. They probably got it from a friend or something, which is illegal. and they simply did not put in the effort at all throughout the semester to uh, take their exams and get work done. They hadn't planned. And you might say, well, are they not planning because they have ADHD? Yeah, sometimes that does happen indeed, but it's oftentimes that somebody just wasn't committed and that they were just not serious about the main goal, in this case, being in college. So those are some things folks can think about if they think they have ADHD.
Well, how often do you think kids aren't diagnosed and then someone makes it all the way through to adulthood
Mhm.
and they're looking at some of these things and they're thinking that they have ADHD? How often do you think that they don't get a diagnosis until they're an adult?
Yeah, that happens a lot. That's a phenomenon that often happens with little girls who reach adulthood then. And the reason is back in the day, 20, 30 years ago, it was like the rambunctious little boy that couldn't sit still in his seat that would get referred to a psychologist or psychiatrist. And they would interrupt class, things like that. ADHD stands for attention deficit and hyperactivity disorder, but really there's three versions of that one could have. It could be they're inattentive, like they're just not focusing and they're like an absent-minded professor, or they're hyperactive, meaning they can't sit still and their body wants to move. They're fidgety, or they have both of those things, which is called combined type. So if you have a little girl who has inattentive type, who's like absent-minded, staring out the window in class and daydreaming and such, not completing their work, often told that they're very smart, because many of them are, they will grow up, and it's not until they're 29 and they just got into law school and they're like, hey man, I can't keep up, or medical school or something. Or they have a job where they got promoted to general manager and they're super smart, but they just can't keep up with that kind of detailed work. They can't procrastinate anymore to complete the work, where they like let it build up the night before, and within 1 hour they write a whole term paper, that type of thing. They need better planning than that. So I see a lot of patients who come in with that, and it's really pleasure to make the diagnosis for people because they've suffered so much, and their academic careers often have been derailed. I've had plenty of patients where we treated them, and they went from getting like speeding tickets to in car accidents from like just inattentive like fender bender stuff, not succeeding in the workplace, thinking that they're smart, but just they couldn't focus, and they think they're anxious. And once we get them treated, they go on to start a business. I've treated a patient who went on to get another degree and then became like a teacher within her profession. And for like 10 years, they were in therapy being told that they had some personality issues. You know what I mean? And like, it was some psychodynamic reason why, like some unconscious reason why they weren't achieving things in life, like fear of success type of thing. But when I met them, it was so obvious that they had ADHD. They also had a family history. Their performance was like, they got C averages in high school and college and failed things, didn't show up for tests on time. And it wasn't because they were hungover. It was just because they had trouble, planning. So that happens a lot. Yeah.
Yeah, so I guess that really kind of highlights how important it is to get a diagnosis, not self
Yeah.
fix it
Right.
yourself.
Yeah, not willy-nilly. It's a tricky thing. If folks out there want to know, like, well, how could I know if I lean towards ADHD? You really have to look back in childhood and say, what was your brain like then? Because we anchor the diagnosis in childhood, and it should carry on through adulthood. About a third of people with ADHD, as they get to adulthood, it goes away, or they're well compensated for it. In other words, they don't need treatment for it. And another third definitely do need, or I guess the 2/3 would need treatment on some level. And so when patients come to me and they're 30 years old and they go, I think I have ADHD, I go back and look at as when they were a kid. I interview parents often, or I have the parents fill out a form, and I mean they're adult or they're old parents by this point, right? So if they have a 60-year-old mom, 60-year-old mom, and they're 30 years old, I'll get the mom to send me something, and patients are often like, "Why do you want to talk to my mom? Why do you want to bother her or my dad?" But I explain like we need to know we need to talk to somebody who knew you when you were 7 years old and what you were like then. And then we all often get somebody else involved, like a boyfriend or girlfriend who lives with the person, or a spouse who fills out a form. And we coach our patient, hey, don't talk to your spouse about this form. Just let them fill it out and give us the information that we need. And we ask things like, hey, in the last 6 months, have you noticed your spouse having trouble completing tasks, being distractible, not completing work, things like that?
Okay.
Yeah. So there you go.
Well, thank you. I think this gives everybody a lot to think about.
Yeah, it's a lot of stuff. I can just talk incessantly.
We like it.
Maybe I have some ADDs here. So anyways.
So thank you for sharing this with
Yeah,
us.
absolutely. You're welcome. All right. Have a good day. I'll see you next week.